It's the sound of the ICU that many of its nurses can hear even at night. All is calm until one of their COVID patients has trouble breathing. So they get kitted up and head in, part of a workload that is 200% heavier than with a non-COVID patient, according to the ward's head nurse.
They have to be really fast to get there, to protect themselves, to avoid taking risks, even as they revive patients. But with all those extra layers on, when they come out, they'll be sweating.
These ICU nurses have already been through the first wave. Some haven't had a break since. Now they're on the front line of one of the fastest spreading COVID outbreaks in the world. The graph says it all. The positivity rate recorded daily in the hospital's lab shows a vertical climb from early October. Tuesday, 2,000 people were tested by this lab. More than half were COVID-19 positive.
Yeah, 20 and 7 October, we have a very alarming positivity rate of 60%.
Which means, say the doctors here, that an exponential rise in patients needing hospitalization will follow within the next few days. Today, this ICU has just one spare bed. All too soon, doctors are going to start having to make impossible decisions about who gets a bed and who does not, about who is most likely to survive.
It's the sort of decision that is contrary to everything we do. The dream of a doctor is to save lives. It's certainly not to say, okay, I will not save this person, and I know it. So it's not the type of decision that we take alone.
Already the medical staff at this hospital gets psychological help, techniques borrowed from the Israeli army that allow them to identify those struggling with being on the front line of a war that no one is winning and that few outside the hospital really understand.
Le message, il est très clair.
The message is very clear, that all those people who don't respect the rules, who make anti-mask propaganda, should come and spend a day with me at the hospital to see the patients who can't breathe and for whom we can't do very much, to see them isolated from their families because no one can visit, to see them die alone, which is psychologically very, very difficult.
These children have come to say happy birthday from a distance. Their only consolation, that their loved one was one of those who got a bed when he needed it. Melissa Bell, CNN, Liège.